So who actually decides what your goal weight is? Do you have any say? Is it your doctor? Is it your surgeon? What's the difference between goal weight and ideal weight? So here's the deal. After 8+ years, I needed a new doctor. My other one, I was with them for a long time. They walked me through the bariatric surgery, but I needed a new one. She left her practice. Is that I had a new doctor appointment on Friday, and then I had a 3-year post-op with my bariatric surgeon the following Wednesday. The thing is, they had 2 different opinions of my goal weight. What the heck? What is excess weight, and how much excess weight am I gonna lose after having weight loss surgery? Let's talk about it. In this video, I'm gonna talk about why I was so riled up, all the research I did about goal weight, excess weight, ideal weight after having bariatric surgery, and if you stick around, I'm gonna tell you how you can determine your goal weight. But before we go any further, put down in the comment box, has your surgeon determined your goal weight? Is it your doctor that turns the goal weight, or do you have any say in it? So in the comment box, if it's your surgeon, put surgeon. If it's your doctor, you think it's your doctor, put doctor. And if you have say in it, put me. So when I met with my new doctor, I was very grateful that she was willing to do that baseline testing. We did all the tests, rounds of blood work, other tests. I wanted it all, and I was willing to self-pay for that because I just wanted a baseline of data to see where I was at. And if any of you have seen my other videos, you know I'm all about getting at the root cause of things, not just treating the symptom. So I really wanted to know, was there something going on that I wasn't aware of? I am 3 years post-op. I have lost 140 pounds, and I made sure she knew that, but we wanted to look at kind of what is going on and really know, am I vitamin deficient? Is there something else going on? I just wanted that baseline data. Because before having bariatric surgery, I did a lot of soul searching. I wanted this to be the very last time, very different from any diet before. It had to be about my health and nothing else. It really wasn't about the number on the scale. So I made sure she knew that as well. I wanted to treat those root causes, the physical, the mental, and the emotional root causes of why I wanted to have surgery, but also how to maintain my weight long term. She agreed with all that, but then this happened. She stated that she could help me lose another 20 to 30 pounds to reach my goal weight, even suggested weight loss medications. I told her I was not interested in losing more weight. I had lost 140 pounds. I felt pretty darn good at the weight that I had, and I've done the mental and emotional work. I was feeling good about my body, about my progress, and about maintaining that weight loss, 140 pound weight loss for 3 years. I was healthy, so hence I wanted all that blood work and those tests to prove that. She looked at me and went, okay. But I knew she didn't really agree and that she wanted me to lose more weight. She wanted me to get to my ideal weight. And I just want to let you know that at my new doctor's office, I was weighed with that typical doctor office scale. So they took my height and they took my weight. I just want to let you know, I'm going to do a couple additional videos on my blood work, the tests I had, the results, the outcome. I was a little surprised by some of that, so I am going to do some videos about that. If you're interested in that, make sure you subscribe, hit that notification bell so that you can be alerted when I post those. So the following Wednesday, I went to my bariatric surgeon 3-year post-op appointment. The team there weighed me, but they used a different machine. They took into consideration my height, my weight, my muscle mass, my age, and some other factors to determine what my weight was. And they gave me a breakdown of the other things like muscle mass, bone density, etc. So my bariatric surgeon said, wow, what a great job. Awesome. You're maintaining your muscle mass, you're losing fat, you lost 140 pounds. And you're not losing muscle mass as you're losing fat, which is a really good thing. And I was, in his mind, within a very good BMI range. He told me I didn't have to lose any more weight if I didn't want to. He felt I was at a really good, healthy point. But he also asked me how I was feeling. He looked at my other medical conditions that I had prior surgery. He asked how I was feeling physically, mentally, emotionally. So I know a lot of people, especially before having surgery at that beginning stage, you want to know, what is my goal weight? What should I assume is going to happen? How much weight am I going to lose? And the answer is, I hate to tell you, it just depends. So let's talk that through. The thing is, there's no one exact way, no cookie cutter way, no perfect way to calculate how much weight you're going to lose, what your goal weight is, and will that meet your ideal weight. There's this thing called our ideal body weight, and a lot of people think that's your goal weight. It's not exactly the same thing. So for example, if doctors and surgeons are really following the BMI chart, for example, a woman who's about 5 feet 4 inches, if they were in the healthy BMI chart range, their weight would be about 120 to 130 pounds. That's very different to what their goal weight is following surgery. Most bariatric patients, myself included, was 100 and plus pounds before having surgery. They had 100 plus pounds of excess body weight. So your excess body weight is whatever your ideal weight is, and then what is your weight now? What is the difference? That is your excess body weight. So if you're 100 pounds overweight, it will depend on what procedure, and the average percentage of excess body weight loss kind of depends on your procedure. Please stick around, because I'm going to explain that there's many more factors that determine and impact weight loss following bariatric surgery. Most bariatric surgeons will tell you, if you have the VSG, the gastric sleeve surgery, that you'll lose on average 50 to 60% of your excess weight. Gastric bypass is typically 60 to 70% on average loss of your excess weight. And the duodenal switch is a little bit higher. The expectation on average is 70 to 80%, sometimes 90% of your excess weight. Now, I need you, stop. If you're gonna determine, if you're thinking, oh, I'm gonna pick my procedure, depending on what they tell you the average percentage of weight loss is, like you're just gonna not do your research and pick the switch over VSG and gastric bypass just because of that reason, I really warn you, because this is just average textbook information. Because remember, you are not a bariatric patient for just a year. You are a bariatric patient for life. So going back to the example, so if someone had the gastric sleeve, the VSG, and they're 100 pounds, they have 100 pounds of excess weight, and they lose the average that bariatric surgeons are telling you, they'll lose 50 to 60 pounds. Another thing I want to let you know, just kind of interrupting here, is that everyone is different. Everybody loses weight different. It doesn't really depend on the procedure sometimes. I am here to tell you that I had the VSG. I had 100 plus pounds to lose, and I lost 140 pounds. So if I just kind of felt like, oh, what the bariatric surgeons are telling me, I would have only lost 50 to 60 pounds of my percentage, 50 to 60 pounds of weight of that over 100 pounds excess weight that I had. No, I lost double. So they just give this to get us to understand that there's a textbook that is kind of the typical person, but I don't think we're all typical, right? We all lose weight differently. There's many factors that impact losing weight that I'll talk about in a minute. So I just don't want you to oh, okay, well, there you go. I have over 100 pounds to lose and I'm only gonna lose 50. So just to be clear with the example, a person with 100 pound excess weight, and say now they have the gastric bypass, and they lose 70 pounds of that excess body weight. And their ideal body weight was 140 pounds. And say they went from 240 pounds to 175 pounds. And let's just, for example, say they're 5'4". According to the BMI chart, they would still at 175, even though they lost 70 pounds, would still be considered obese. I want you to understand, and really good bariatric surgeons will tell you this as well, is that 175 pounds, your ideal body weight, is just like, you have to determine other things around it. You could be 175 pounds and be super healthy. You could be 175 pounds and not be healthy. The whole goal, it's more important that the whole goal is about your health, your overall health. Did your health conditions improve? Did your mobility improve? Has your sleep improved? Can you do more things that are important to you? How is your quality of life? How many inches have you lost? What does your body composition look like? How do you feel in your skin? So reaching your ideal body weight is not necessarily the goal. However, some people do. They have their ideal weight set as their goal weight. So your goal weight is what you should determine that you want to achieve by losing that excess body weight. Now, some bariatric surgeons, some people want to lose to their ideal body weight. The thing is, can you do that realistically? Is that a realistic goal? If you are 325 pounds and your ideal body weight is 120, do you think your goal weight should be 375 minus 120? Ask yourself, if that happens, can that be sustained long term? Is it a healthy ideal weight? What are the other conditions telling you? How are you feeling? What does your blood work tell you? Are you vitamin deficient? Very importantly, what is your relationship with food? Did that change? And what is your mindset? And the other reality is, and my bariatric surgeon didn't tell me this, but I've done a lot of research and talked to a lot of bariatric surgeons as well as patients, is that they don't let us know that this is what is typical, is that you'll lose your weight after the procedure. You're doing all the things right. You might even have plateaus, a little gain, but you're, consistently losing and you're losing. What will happen is you kind of lose to your very low point, right? And what is normal is that you kind of sustain that for maybe a little bit, but your body will just normally kind of go up again. Like it'll regain a little bit, and then that's where it sustains. Your body's going to really try to balance itself out. It has a lot of mechanisms and functions, and it needs to balance and work together to reach what we call homeostasis. Homeostasis is that steady state. Your body doesn't want to do the up and down. Its goal is to keep at a very steady state. That's what it likes to do. That's what it wants to do. So what is normal once you reach that kind of low point is that most people kind of regain about 5 to 10% of that lowest point. It's normal. It's okay. Your body's doing what it's supposed to do. But to reach that low point, to reach your ideal weight, to reach your goal weight, if that's what you're trying to do, to lose that excess weight, remember there's so many other things you need to be doing. Fully hydrated, eating proper healthy portions, eating quality of ingredients. Are you not picking up old habits like food addictions, disordered eating, stress eating, emotional eating? So you can kind of figure out what to expect and what kind of results that you'll get on the following. Now remember, everybody is different. Everybody loses different. There's many factors that we're going to talk about that impact weight loss. Figure out what your ideal body weight is. Now that can be hard for some of us. Some of us have never been there. Never maybe. Sometimes some of us have been overweight from toddler on. So sometimes understanding what the ideal body weight is can be a little difficult. But let's say you have an ideal body weight, then what is your current weight? Difference between those, your current weight minus your ideal body weight, that difference is your excess weight. Multiply that by the percentage depending on that average, what procedure you're gonna have. And that's gonna give you what a reasonable goal weight might be. Now remember, everybody's different. And that's kind of, for many people, that's the low end. That's the low end they're giving us. So now let's talk about other factors that impact physical weight loss. Remember, if you are heavier, you have more to lose, and typically your percentage will go up. Other factors is age, gender, ethnicity. These are our socio-demographic factors. Hormones, existing comorbidities like other medical conditions. What medications are you taking? What vitamin supplements are you taking? Quality of ingredients of the food that we're eating. Are we eating closer to whole foods or are we eating more processed convenience foods? How much sugar and hidden carbs are we eating? Do we have diabetes? Do we have other obesity-related medical conditions that we are challenged with? Do we suffer from sleep apnea? Are we involved in additional supportive therapies? How is our stress management? Hydration, genetics, our metabolic rate, our gut health. Do you have any food sensitivities? Your emotions? What are your habits, your relationship to food? All these and much, much more impact the physical weight loss. I also believe that we need to do a lot of work on mindset and how to lose the mental and emotional weight as well. Surgery doesn't necessarily help us with that. We have to do that, surgery or not. So I returned to my doctor after having all this blood work and tests to review that. And she mentioned again, well, you know, when you're ready to lose that extra weight, then I'm here for you and we can talk about other things like medications, etc. I finally said to her, my bariatric surgeon feels like I don't have to lose more weight. I don't want to lose more weight. I feel good, and let's take a look at this blood work and these tests to see that. I also was thinking in my head, you know, I do have loose skin. I lost 140 pounds. Of course I have loose skin. But you know what? I don't know if I'm ready. I'm okay to accept this loose skin. I don't know if I want any more loose skin. I feel good. I am doing all the things. I don't want to lose. I feel like I've reached my goal weight. It might not be my ideal weight. It might not be what the BMI chart says, but I'm good. I'm good. The thing is that I'm not sure, but I'm pretty sure she has never struggled with weight and probably never, ever has lost over 100 pounds. So who decides your body weight, your goal weight? I think it's you. It has to be you, right? Your doctor can have an opinion. Your surgeon can have an opinion. All those other people can have an opinion. But in my opinion, I think it's you. And I don't think you should use a number on the scale or a range or a number or a category from a very outdated BMI chart to determine you've reached goal weight. There's so many other things to consider. Remember, it's your body, your health, and your life. So I think the next two videos that would really help you with this conversation is one is liars. I really dig deep into what is the body mass index, the BMI chart, the research on it, what does it actually tell you, and then the number on the scale. The video is called Liars. I think you'll get a lot of good information about that, and so that you can kind of think bigger and broader about, you know, this journey is more than just a number on the scale or a category on the BMI chart. The other video that I have, it's an older video, but it's still very applicable, is sometimes we don't have the skills or the knowledge on how to have a difficult conversation with our doctor or our surgeon or our nutritionist or anyone else out there. So I have a video that's called How to Have a Difficult Conversation with Your Doctor. I think it's really important to know how to do that because you need to advocate for yourself. And in that video, I actually give you a script that you can just cut and paste, fill in your own words. Until then, take care, and I'll see you in the next video.